I liked cardiology. I found cardiology to be very challenging. It's a specialty where you diagnose, you think, you talk to people, you examine them carefully, more like a detective would do, rather than some specialties, surgical specialties, where you do a lot of things. Here I'm able to think and work with patients and solve their problems, and that was attractive to me. Other people like the surgical side, but this is what I liked. My focus is basically three things. Number one, I need to make a diagnosis and find out what's wrong with patients. I mean, that's why they come. Number two is I have a very strong emphasis on prevention, which is a key. It's a key in people who have never had heart disease but seem to have a predilection for it, like a lot in their family, have high cholesterol, things that make them likely to be heading in that direction. And other people have already had a heart problem. So those patients also need prevention. We call that secondary prevention because they've already had an event. So we try to prevent a second and a third event. And that's really the strength of my practice. I'm a diagnostician, and then I'm a preventive cardiologist. I'm board certified in nuclear cardiology also, and that's part of my diagnostic focus. So I do a lot of that. In fact, I run the nuclear lab at our local hospital. But my real interest is prevention and diagnosis. Not my real interest. The favorite part of my day is when I can work with patients in preventing problems. Well, it's using nuclear material to help diagnose heart disease. Basically, most people would know it as a nuclear stress test. Or we use radioactive material to assess the function of the heart. Very important in people receiving certain types of chemotherapy. We will use those techniques. The nuclear stress test is the large majority of nuclear cardiology. People who have chest pain, who have shortness of breath, who have an abnormality in their electrocardiogram that their family doctor found, they'll refer them to me for further evaluation. In other words, does this patient have heart disease or not? The nuclear stress test permits us to measure the blood flow through the arteries of the heart and make a much more precise diagnosis than just an electrocardiogram or more simple techniques. If you have heart problems, you come to my office, listen, I'm not gonna give you a sermon. I'm not gonna wag my finger at you. I'm gonna educate you, and I'm gonna encourage you, and I'm gonna work with you. Not against you always saying, you didn't do enough. I've heard that. I've heard patients come to me and say, my other cardiologist would always wag his finger, would make me feel guilty that I didn't make enough of an effort. And that I never do. I work with them, and I think that kind of patient does a lot better than the one who's talked to, and kind of that I don't know, that sermonizing way, that kind of an accusatory way. You're really not carrying your weight. That's not true. What I enjoy is what I've always enjoyed, living on the coast. It's a lifestyle, it's more relaxed. Coastal residents enjoy life, I think, a little bit more than some other areas, and I like that. It's just the general lifestyle, the beauty of the area. I like to walk on the beach. I like to do some fishing. I don't like the bitter cold. I kind of like the winters in Florida, I must say, but these are not too bad, So overall, it's just the quality of life here.